I want to read a couple of statements. You may be familiar with them. The first statement is, our needs are identical with labor's needs. Decent wages, fair working conditions, livable housing, old age security, health and welfare measures, conditions in which families can grow, have education for their children, and respect in their community. That is why black people support labor demands and fight laws which curb labor. That is why the labor hater and the labor baiter is virtually always a twin-headed creature spewing anti-black epithets from one mouth and anti-labor propaganda from the other side of his mouth. That was Dr. King, December 1961 at the AFL-CIO convention. Listen to this one. He says, as I have said many times, and I believe with all my heart, the coalition that can have the greatest impact in the struggle for human dignity here in America is that of African Americans and the forces of labor, because their fortunes are so closely intertwined. That was January 62, a year and 8 months before the I Have a Dream speech. Dr. King, labor. Civil rights movement, labor. Then he says finally in 67 in New York at the Teamsters Convention, today, and I'm using African Americans, he would use Negro, today African Americans want above all to abolish poverty in their lives and in the lives of the white poor. This is the heart of their program. To end humiliation was a start, but to end poverty is the bigger task. It is natural for blacks to turn to the labor movement because it was the first and pioneer anti-poverty program. It will not be easy to accomplish this program because white America has had cheap victories up to this point. The limited reforms we have won have been bargain rates for the power structure. There are no expenses involved, no taxes required for Negroes to share lunch counters, libraries, parks, hotels, and facilities. Interestingly, we don't hear much about this when we talk about Dr. King. Even the more substantial reforms, such as voting rights, require neither monetary or psychological sacrifice. The real cost lies ahead. To enable the Negro to catch up, to repair the damage of centuries of denial and oppression, means appropriations to create jobs and job training. It means the outlay of billions for decent housing and equal education. This is May 1967, less than a year before Dr. King would be shot. Clearly in his mind, he understood that there could be no separation between labor and civil rights if in fact we were going to move this nation forward. And because he was talking like this, we often don't hear it in the history books, he was talking like this and others, not just him, I'm just using him as a representative of civil rights voices and labor. In this state in 1959, the Jim Crow law, we call it, of GS 9598, prohibiting collective bargaining among state, local, and municipal government workers was put on the books by an all-white legislature in 1959 in North Carolina. And make no mistake about it, some records say it was because they were afraid they were going to organize the firemen in Charlotte. But the reality is this law was put on the books the year after the end of the Montgomery boycott. And the deep fear in North Carolina and throughout the South was that unions would come in and organize African Americans, and for the first time there was a real opportunity to organize the South and bring working class poor whites and blacks together in a liberation movement. And North Carolina tried to cut it off at the pass by putting on the law, on the books, GS 9598, which still exists today. It's one of the last Jim Crow laws that still exist, and now that law prohibits teachers and mental health workers and government workers and firemen and sanitation workers, all who work for the government, state, local, county, or state, from collective bargaining rights. And then we come to mental health hospitals, Lassine. And mental health hospitals have a deep racial history. In 1851, Dr. Samuel Cartwright, a prominent Louisiana physician and one of the leading authorities in his time on the so-called medical care of the Negro, he identified 2 mental disorders. One of them he called drapetomania, or the disease that causes Negroes to run away. And he, as a renowned mental health psychiatrist, called this a disease. He said the cause in most cases that induces the Negro to run away from service is such a disease of the mind as in any other species of alienation, and much more curable as a general rule. And the treatment for this drapetomania was for planners and overseers to utilize whipping as the primary intervention to fix this mental condition. This was actually written in journals of medical. Then he also diagnosed another one, and he called it the heptitude of the mind and obtuse sensibility of the body, a disease peculiar to Negro, which he called rascality. And he said that was a mental condition. Black folk acting like rascals. And again, his treatment for this mental condition was the shock treatment of the whip. The shock treatment of lynching some so that others would be cured of these 2 mental diseases. African Americans were frequently housed in public facilities such as poorhouses and jails or the insane asylum. These facilities almost always had substandard conditions. If conditions in the facility were poor for white patients, the conditions were completely inhumane for African American patients. And the issue of housing black and white and mental patients in the same facility was a struggle in both northern and southern states, since many leading mental health experts of the 17 and 1800s felt that it undermined the mental health of white patients to be housed with African Americans. The distress of having black and white patients in close proximity to one another was balanced by the unwillingness to fund segregated facilities for black patients. But then, in 1877, the North Carolina General Assembly appointed a committee to recommend the selection of a site for a facility for the mentally ill, which would serve the entire state. On April 11, 1878, 171 acres of land 2 miles west of Goldsboro were purchased. And this site was described by Governor Zebulon Baird Vance, who had been a leader in the Confederate Army, who was called the War General of the South. He oversaw this. And he said that this would be an ideal hospital because of good elevation in a high state of cultivation and central location for the black population. On August 1st, 1880, the first patient was admitted to what was known first as the Asylum for the Colored Insane. For the first 85 years of its history, Cherry Hospital served the entire black population for the state of North Carolina. It was only in 1965, after the civil rights community and labor won the 1964 64 Civil Rights Act, that Cherry was forced, along with other state hospitals, to begin serving people from all races and hiring people from all races. It was only after the victory of the Civil Rights Act of '64. Now you will remember, if you know your history, in 1925, Junius Wilson, a 17-year-old deaf and muted black man, was accused of rape, castrated, and remanded for incarceration at Goldsboro by a lunacy jury. The rape charges were eventually dropped in 1970. And at some point, the authorities realized that Mr. Wilson was neither mentally ill nor retarded, simply hearing impaired. In 1994, 24 years after the charges were dropped, and Mr. Wilson was 86 years old. He was moved to a cottage on the grounds of Cherry Hospital. And the move to the cottage was the state's only effort to make up for Mr. Wilson's 72 years of incarceration. And he died 7 years later on the campus of Cherry Hospital. The issue of race and poverty have always had an ungodly intersection in our mental health systems in this state and in this country. Bring it forward. We saw clearly the intersection of race and labor in the Dix closing. The impact of the closing of Dix on African American patients, because more than half of the patients admitted to Dix, Dorothea Dix, were minorities, 50.6% in 2008, 52% the previous year. And when you look at mental health workers at Dix that were displaced, nearly 100% of the 302 healthcare technicians who were on the front line, people who worked with patients, were black at Dorothea Dix. Of the Dix housekeepers, 38 out of 39 are black. All 19 workers in the kitchen at Dix were black. There are 103 RNs, 52 are black, 7 are Asian, Latino 22, 29 LPNs are black. In short, 433 of the 492 frontline workers at Dix Hospital, when they decided to do the final stage of closing it in the middle of Christmas, were black. So when you mess with mental hospitals, you disproportionately affect people of color and poor people, both in terms of workers and in terms of patients. Otto Schwammer said, we live in a time of massive institutional failure, collectively creating results that nobody wants. Climate changes, AIDS, hunger, poverty, violence, terrorism, destruction of communities, nature, life, the foundations of our social, economic, ecological, and spiritual well-being are all being undermined. And until we develop what he calls the ability to remove the blind spot of conscience, we will still wrestle with these issues. The reality is how we treat the most vulnerable among us and how we care for those who treat the most vulnerable among us is a moral question, is an economic question, is a labor question, and is a question of civil rights. And that's why this coalition is so important. And that is why there can never be a separation between labor and civil rights.